friends, I am Dr. Sadeep. In my channel I will be uploading videos concerning practical application of homeopathy, how to practice homeopathy in a classical way. So I have already done so many videos about these subjects. Friends, if you are interested in these type of subjects, please like, share and subscribe our channel. And today's subject is a very important subject because everybody will be worried about this miasmatic aspect in each individual patient. So what is this miasm? What is this dominating miasm? So we are not only worried about this miasmatic aspect, and every master and every homeopathic physician will be telling that dominating miasm is to be treated, dominating miasm is to be taken care, and the disease will be in the recovering phase if you take care of this dominating miasm. So what is this exactly miasm means? What is this exactly dominating miasm means? So miasm is one of the genetic tint of each individual person. That is to say, this miasm is nothing but the genes. We have, all human beings have so many types of chromosomes. There are 36 chromosomes, as you know. In these chromosomes there are genes. Genes are nothing but your characteristic good and bad tints, your characteristic individuality of each individual is nothing but genes. It carries both good and bad things in together. Whatever is manifesting is in the superficial or in the depth will be taken care by these genes. If a person is more irritable, if a person is more fearful, if a person is more enthusiastic, if a person is more addicted to some of the habits, then it is because of his genetical factors. So whatever he has a trigger from the genes will be manifested on his face, mind and his actions. So this is nothing but the miasms. So in this category, what we want to understand is which type of miasm, which type of genetic makeup is in him and which is dominating in him. So we have totally around 7 miasms which we will study in detail. So in these miasms, which characteristic genetic tint is in his background and which is dominating, which is having a more say in his life aspects, in his business, in his academics, in his life. That is very important because all human beings have psora, syphilis, psychosis. So one will be having more, one will be having less. So due to that reason, what we have found is which is the dominating miasm is the very important factor to decide on the which medicine to give and which medicine will have which dominating miasm itself. These are the very important things what a homeopathic physician must always see to it. That is to say, that is not only just matching the medicines and giving to the patients. No, it will not affect. So I have seen in my practice many a times I have given a totality medicine. But the thing is, miasmatic aspect, if you are lagging, miasmatic aspect, that is the genetic tint which is dominating in the patient. If you lag, then there will be a possibility that the medicine will not do a miraculous effect on the patient. Due to that reason, we will be always worried about these things. What is this dominating miasm? What is this miasm? What exactly we want to know about the patient is his total genetic makeup, his total familial background. What is the thing which is triggering in its roots to produce a disease in his total systems? So this is one of the important thing in the homeopathic practice, friends. As you come across many of the patients, you will understand only finding the numerical totality or a totality of a medicine will not many a time affect the individual, and he will come back and tell, no doctor, the symptoms are as it is like. Then you must be very keen in observing the patient and you must be focusing on the genetic makeup, miasmatic background of the patient. Then only the miraculous effects are possible. So in this way, what we will do is we will study each and every miasm in its totality, in its total presentations. So few miasms are very dominating in few of the people. In those people, the same miasmatic medicines to be given. If not, the mismatching of miasms also will not reach the totality of the symptoms. Due to that reason, we always worries about the miasm, dominating miasm. So dominating miasm is a miasm wherein that features will be more prominent in him, and he requires the same dominating miasm in his medicine also. So this is the whole key of practicing the homeopathic practice. And if a person is perfectly understanding what he is doing, where he is targeting his medicines and making the body system in a regularizing way or a balancing way, then the possibility of cure will be 100%, friends. So this all about this miasm, dominating miasms. So dominating miasm is a miasm wherein it will be featuring itself on face, on his actions, on his daily routines, his food habits, and many other things it will be dominating. So the person, the homeopathic physician must be in a position to recognize that dominating miasm and give the medicine for that miasmatic background and matching the totality of the medicine. This is the key factor in our practice, friends. So this is all what I wanted to talk today, friends. If you like this video, please like, share and subscribe our channel. And if you have any queries, please put in the comment section. I will try to answer all those questions, friends. This is all today. Thank you and take care, friends.